Now we start scanning by using linear probe at pelvic area. Now we are scanning the suprapubic area above the bladder. Here we see the distal part of small intestine or distal ileum. Now we sliding the probe downside to locate the urinary bladder. This is urinary bladder and this is anterior wall of the urinary bladder. Now we slide in upward to locate the small intestine by placing the transverse position of probe. Now we slowly sliding the probe towards right iliac region to locate the ileocecal junction or cecum. Here we see the distal ileum walls are prominent. A hypoequic line is muscular layer, muscular propria, and echogenic lining inner to the hypoequic lining are submucosal layer. The walls of ileum are not visible due to full of gases when they are normal, but when there is some inflammation, they become visible and prominent. Here we see the echogenic lining. These are gases. Here we see the walls of gut tube are more prominent and thickened and become an enlarged part of the intestine. This is cecum. The gases in the large gut loops are appear as bubbles due to hasturas. So we can appreciate that this is the large part of the gut or cecum due to gases bubble appearance. In small intestines, the gases are appear as a echogenic thin line, and in large intestine, gases are present as bubbles due to hasturas. Now we will scan the cecum from right, left, and up and down to search the appendix. We will fix the probe at this point and stop sliding, and then tilt the probe from up, down, and right, left to search around the cecum. Now at right side of the cecum we see an inflamed part of the gut in cross section view. The muscular layer and submucosal layer are inflamed and thickened. Here the surrounding tissues of this lumen are also echogenic and inflamed. Now we will rotate the probe at this point to get the longitudinal view of this lumen. Here we see the wall of this lumen are inflamed. This lumen is suspicion of appendix. Now we follow the endpoint to see the blind end of the appendix. And here we see this is blind part of the appendix. The walls of appendix are inflamed and thickened. The hypoechoic line are muscular layer of the appendix, and the echogenic lining are submucosal layer of appendix. Normally the appendix diameter is less than 6 millimeter, and we cannot find during scan due to gas shadows. But when it is inflamed, we find out easily if there is no gas shadows. Here the appendix is attached with the wall of cecum. The walls of cecums are also inflamed due to inflammation of appendix. Sometimes we didn't find appendix, but if you find out that the walls of cecums are inflamed, then we try to find out appendix, as cecum walls and distal ileum walls are mostly inflamed due to acute appendicitis or inflammation of appendix. This is cross-section view of the appendix. Now we will measure the anterior posterior diameter of the appendix. The anterior posterior diameter of appendix is 14.4 millimeter. The normal diameter of appendix is less than 6 millimeter. Now we will scan the peri-appendicular region or around the appendix to see any collection. Here we see the tissues around the appendix shows heterogeneous texture due to inflammation, and here we see minimal fluid in the soft tissues due to inflammation and leakage of appendix. This is femoral artery. Mostly appendix lies anterior to the femoral artery. This is common femoral artery, and this is common femoral vein. Now how we will write report.